Hello everyone. Here we are going to discuss an important topic that is leiomyoma, uterine leiomyoma, also known as uterine fibroids. In university exam, you usually get a short question on that, either on its etiology, types, gross, microscopy or clinical features. So it's a small topic yet very commonly asked in university exams. Tumours of Myometrium, one of the important tumor of myometrium we are discussing, that is leiomyoma, also known as fibroid. More commonly it is known as uterine fibroid. So we will understand the topic under following headings. First I will let you know the introduction. What do you mean by leiomyoma? What is leiomyoma? Where does it occur? Then the age of its presentation. Then its etiology, its type, the three types: gross, microscopy and clinical features. So you always write your answer under the headings in your university exam. I always insist it. Okay. So before coming on these topics, please understand the three layers of the uterus. In the female reproductive system, there is uterus. Uterus is the organ. There are three layers in the uterus. The innermost layer is known as endometrium. Can you appreciate? This one is endometrium, the innermost one. The middle one is the myometrium. Can you appreciate? The thicker, the most thickest, the middle layer. This one, the thickest layer is the myometrium. This one is the myometrium. And the outermost one is the perimetrium. The outermost one. This one is the perimetrium. These are the three layers. You can appreciate the three layers here also. Can you see the three layers here? Please appreciate the three layers. So of the uterus, this is endometrium, you can see, this is perimetrium and this is myometrium. The thickest one is the myometrium. See it again. See the thickness of the myometrium. Now I am teaching you leiomyoma. So leiomyoma is a tumor of which? It is not a tumor of endometrium. It is not a tumor of perimetrium. It is a tumor of myometrium. So leiomyomas. Let's start the topic leiomyoma. It is the most common uterine tumor. It occurs in the myometrium. That's why they arise from the smooth muscle origin, because they are present in the myometrium. Please appreciate, they are present in the myometrium, not in endometrium, not in perimetrium. They are present in myometrium. They are totally benign. They are never malignant. Rarely they can convert into malignancy. Then it is known as leiomyosarcoma. But leiomyoma is malignant. Once it converted into malignancy, rare of the rarest, it is known as leiomyosarcoma. But usually it is benign. They are also known as fibroid. So you can get a question on fibroid. So you must understand, fibroid is the other name given to leiomyoma only. Most common age is the reproductive age group. What is the reproductive age group in a female? From menarche till menopause. So menarche is 15 years, menopause is 45 years, so 30 years is age of reproduction. So reproductive age years only it occurs. So it never occurs before the age of 15 or 20, and it never occurs after menopause. After menopause, if they are already there, they will regress in size. So it represents that the most common etiology is the estrogen. Estrogen is required for their proliferation. For their proliferation, what is required? Estrogen. Now, this is the life of a female. In the female, this is the birth of a female. This is the death of a female. This is menarche. What is menarche? Menarche is the start of menstruation, which occurs at 15 years usually. And what is menopause? This is menopause. Menopause is stoppage of menstruation that usually occurs at 45 to 50 years. So this is the 30 years of reproductivity in the life of a female. This is the reproductive age group where the menarche and menopause, between the menarche and menopause, the ovaries are activated and estrogen is present. And I'm saying for leiomyoma, for fibroid, the estrogen is required. So it means that the fibroid or leiomyoma occurs in the reproductive age group. They never occur before that, and after that they never occur. But if they are already present in this group after menopause, they regress in size. They shrink in size because here estrogen is not present. Ovaries are shrinking. That's why. So the estrogen is required for their proliferation. What is the evidences that estrogen is required? So we have seen that it increases in size in pregnancy. During pregnancy, what happens? Imagine a female. A female is already having a fibroid in the uterus and she becomes pregnant. The female is already having a fibroid in the uterus. It's asymptomatic. And during pregnancy, it increases in size, because during pregnancy, there is more estrogen in the blood. More estrogen, that is causing increase in size. Or high dose of estrogen therapy. If some female is given external estrogen, the fibroid increases in size. Or after menopause or after removal of the ovary, it regresses in size. So this proves that estrogen is required for its proliferation. That is the etiology. So see the introduction, see the age, see the etiology. Now coming on the types. There are three types. What do you mean by that? Now, in the diagram of the uterus, what are the three layers of the uterus? Innermost is endometrium, then the middle is the myometrium, and outermost is the perimetrium. We will draw the three layers. Let me draw the three layers here for you. So here I'm drawing the endometrium. Okay, so this one is endometrium, endometrial lining. Now I'm drawing the thickest layer, that is myometrium. This one is the myometrium, and the outermost one is the perimetrium. Let me draw the serosa or the perimetrium. This one is the perimetrium. Now, where is the fibroid? What are the three types of the fibroid?